Hi, welcome to Mad Medicine with Miss P. I got some really fun stuff here. I guess they're all kind of learning experiences, since I sort of got away from the teaching that she requested. But like I said, when I'm out of what I know, this is the rest of what I know. I know that I love my job, but it is sometimes painful. So I got lots of stuff. And I think I was only in there a half a day. It doesn't take much. And just from other patients and other professionals, they gave me some fabulous stuff. I mean, I have like a lot. There's probably 2 or 3 videos on here. We'll see how far we get. Okay, so I'm speaking to this, nice guy, and they all are. I mean, very few do we have like, straight up mean, evil patients, but this guy says, and every time I say this, I get one of like 3 responses. I'll ask, have you ever had MRSA? And sometimes I get, oh, what's that? I'm kind of like, well, if you've never heard of it, then you probably haven't had it. So just I'm not going to give you a lesson in MRSA right now. So I'll say it's methicillin resistant Staph aureus. Oh, yeah, I never heard of that. Okay, so no. So a long time ago, you could have just said no, but that's okay. Then I get stuff like, I don't think so. I'm like, you would know. It can be a life-threatening infection. You would know if you had it. So this guy says he just says no, which is the correct answer. He was like, I don't think so. He finally gets to no. I said, okay. And I don't think he said, what's that? But probably. Then later, after, after I get down to the surgeries, and forever, this is like I always say there, they say, well, the most recent surgery, no, I need all of your surgeries. So eventually he says, well, yeah, I had a surgery, but that was years ago, 2019, years ago. He had an IND in his right calf. Now, what he said was, I had a boil come up there and they had to clean it out, and I was in the hospital for 3 weeks. It's probably MRSA, right? I said, did you have like IV antibiotics and, they had to do wound vac or anything like that? He's like, yeah, they did something like that. Okay, was it MRSA? Yeah, I think it was. Okay, this is the same gentleman I just asked a little while ago if he ever had MRSA. And, he's like, what's that? Or I don't think so, or no. And now suddenly he knows not only what MRSA is, but that he had it, and he spent 3 weeks in the hospital with MRSA. Okay. All right. And I really want to say all of these, like I keep thinking that I'm going to have the guts to say something like, all right, I'm going to get your health history here, and these are all yes or no questions. If you need to elaborate on them because it's a yes, just let me know. And I haven't been able to say that yet because you won't believe the life stories you get. I was on the phone for 38 minutes with this one person without even significant history. They just talked about their family and who was sick in their family and what other things were going on in their family. No one in the family is having surgery, just this person. So I said, oh yeah, they never know what surgery they're having either. And I noticed that's a big one too. I'll say like, what surgery are you having? Oh, hell if I know. That doesn't really seem like a legitimate response to knowing what type of surgery we're going to do once we cut you open or get into an orifice. You should have an idea. You don't have to know the medical terminology for it or what your consent's going to say, but you should have a little bit of an idea. And the things they say truly are astonishing. He's like, well, the doctor knows. Well, that's true, but the doctor also is doing 1,000 different other procedures, on a weekly, monthly basis, and you're going to want to know which one you're having to make sure you're having the right one. And they always say something like, "Oh, I don't know, he's lifting my eyes or something." And this guy's having a bilateral upper lower lid blepharoplasty with brow fixation, and that he has no idea. And I know this doctor. I know this doctor went in and told them in detail, drew pictures and uses like the little end of a Q-tip to show them like, where it's going to be and what the problem is, talk about their vision. I know these doctors at any rate. So another one's, and this is a forever thing. Are you taking any medication? Yeah, I just take these 3. Just these 3. And I eventually get the names of the meds, the dose, the routes, and the frequencies. Nothing else? No, I don't think so. Anything for pain, anxiety, sleep, dizziness, nothing like, oh, well, yeah, hold on a second. And then they go get, two or three more. And then I do the same thing. Any lotions, creams, ointments, inhalers, nasal sprays, eye drops, ear drops, patches, nebulizer treatments, injections. Oh, yeah, I take insulin. You're insulin dependent diabetic, and you weren't going to just mention that. You're just going to fail to mention that. All right. And especially the Ozempic. I don't know if you guys know about these new kind of weight loss injections, whether you're taking them for diabetes or weight loss. They significantly slow gastric emptying. So they're finding all over the place now that there's gastric content after anesthesia still, and they're finding out the hard way. So you guys need to know how these medications work. Yeah, so this guy was on like Ozempic, insulin, and Flexeril. Totally, was not going to tell me. No, I'm not. Oh, and then we go through the medications. He's like, well, they always say, didn't you get that list from the doctor? Yeah, sure, I can read it off. Okay, all right. I've got, losartan 100 milligrams twice a day. No, I don't take that anymore. Gabapentin 100 milligrams. No, I don't take that anymore. Okay. But they do feel free to mention their Cialis regularly. And I guess I want to know, like, why do I have to teach you about your surgeries? Why am I explaining to you what kind of surgery you had, or how important it is that you know what kind of surgery you had? This guy had like spine surgery and has no idea if it was a lumbar laminectomy, a discectomy, like the other guy who had his back cleaned out. We don't do back clean outs. It's not like it's like a colon cleanse that we do. There's no cleaning out of the back. I mean, I understand what you're getting at, but that's not necessarily a thing. My favorite is this was one of the best ones ever. My coworker comes to me, she shows me that the patient had a colonoscopy and then had a colonoscopy reversal. They were looking in your colon and then slowly backed out and reversed from your colonoscopy. Okay, so surely they mean colon resection, which ended up with, I'm assuming a colon resection ended up with a colostomy and then had a colostomy reversal. That's totally legit. Not an endoscopy though. They're completely and wildly different things. Okay. Oh yes, I did talk to the sweet little guy. He was like talking to the lawyer from my cousin Vinny, the defense attorney, the second defense attorney that the other guy chose because he didn't want Vinny. And he had just such a severe stutter. Oh gosh, I felt so bad for this guy. He was so sweet. But I actually talked to that guy, so it was interesting. Here's another one. This was the guy, and he took him a little while to get the story out. He was so cute. I said, have you ever had, this is the question, have you ever had an injury to your back, neck, or nose, like from trauma, like a traumatic injury to your back, neck, or nose? He says, nope. And then when we get to surgeries, or we had to go back to surgeries, because he fell off of a roof holding a generator, I think he said, and if he didn't, it would have fallen on the 70-year-old man at the bottom and would have killed him. And I was like, that is a wild, interesting story. But your answer to my original question is yes, that is traumatic. That wasn't planned. That wasn't wear and tear. That was a traumatic experience that you had falling off a roof. And he ended up having to have surgery on his L3 to 5 were fused after that. At least he knew what surgery he had. But I'm like, yes, that's a traumatic. What do you guys consider a traumatic or an accidental injury? Like if that's not accidental, this guy must have been a badass. Like I can't even imagine. Oh, then he proceeded to tell me, as I think I said, I don't even know how we got on this subject, but he went on this long story how he just got back they went on a family trip and his wife had washed his clothes with Tide and he got a really bad rash all over his whole body, but it should be gone before surgery. So there's no reason to tell me that at all. Like completely non-related, unimportant. Just that's how you get to 38 minutes. This is how you get to 38 minutes. Oh my gosh, I can't even. Okay. Oh yeah, when you call to check on them from Monday, so we'll say, hi, this is the surgery center calling to see how you're doing after your procedure on Friday. And they're like, well, when I left there on Friday, I'm like, oh God, no. You can't go back 3 days. That's no, how are you doing today? And I even say that. No, no, no. We just want to know, how are you doing today after your procedure? Nope. Still they start from Friday. And then they go into like how Saturday went and carry on about how how they felt on Sunday morning. I'm like, oh, I got the whole scoop. The whole scoop, whether you like it or not. And then oh, what is a double hernia repair? Can someone explain to me what is a double hernia repair? You realize you can have a right inguinal hernia repair and an umbilical hernia repair. You can have a ventral hernia repair and a hiatal hernia repair. You can have a left inguinal hernia repair and an incisional hernia repair. They always say double, and then I have to say, do you mean it's both groins? You're having a bilateral inguinal hernia, and I know they don't understand the word inguinal, and that's fine, but there's no such thing as a double hernia. Like it usually means one thing, but in this case, it actually didn't. His was incisional and ventral, and I wouldn't, if I just wrote double, or just or just kind of after talking to him, I got to the bottom line. It wasn't inguinal at all in this case, which is really weird. And I think I was asking. Oh yes. Okay. So this patient said that, oh, this was a tricky situation. It says, have you ever seen a cardiologist? And she says, yes. And then in her reasoning was for temporary blindness in 2022. I don't understand why people think a stroke and a heart attack are the same thing. They're really, really not. They're not related at all, other than the fact that they might both possibly have been caused from a blood clot. Other than that, or a foreign body, or what, they're not the same thing. So I had to took forever to get to the root of why. And then she wrote someplace else under stroke. She said, yes, I had a TIA. TIA is not a stroke, but fine. I left it in there and, put a little note and explained some stuff, but temporary blindness. So you saw a cardiologist. They cannot help you with blindness. No cardiologist, no matter how good they are, is going to be able to help you in any way, shape, or form for your temporary blindness. It's heart. They're not related. This other patient had a cholecystectomy and a bladder removal, a gallbladder removal. She had her gallbladder removed and a cholecystectomy. You think it grew back? Some things do. Glandular tonsils, people can have 2 tonsillectomies. I don't think you have 2 gallbladders. It's possible. I've seen crazier things, but probably not. Additional cardiac info. Yeah, I had a TIA. That's not what that is, but all right. Yeah, and in that little, God, I'd really like to remove that where it says, what can we do to make this the, best visit for you, or take good care. And it says, when I'm in your care, I'm your priority. What other priority can we have when we're all in the room for only you? There's no other patients in there. It's literally just you. You are the priority. What kind of experiences do you think these people have had? Like, how sad are other facilities, or what kind of issues have they had that's a problem? Okay, so then this other lady wrote that she has diet-controlled diabetes. And, I looked through everything and it turns out, that she's not diabetic. Diet-controlled diabetes, that means if you have discipline and self-control, that doesn't make you non-diabetic or diabetic. We could all be diabetic if we try real hard, but that means you're not diabetic. And then, of course, then I keep looking, and she takes metformin 1,000 milligrams twice a day, and Trulicity, and Trulicity, and she thinks she has diet-controlled diabetes. No, it's medication controlled because you actually have diabetes. I don't understand. I don't understand what you don't understand about diseases. If you take a pill for it, you have it. There'd be no other reason to take a pill. Like when there's certain medications that can do other things. So I will ask, I see you take Cymbalta, do you have depression, anxiety, a little of both, or neither? Because sometimes Cymbalta and some of the other medications are used for chronic pain. But when they say something like, well, my wife died, so, they put me on Cymbalta. So yes, the answer is yes. I have depression and it may be currently being controlled by this medication. I don't, yes and no are really important words everybody should incorporate in their vocabulary. It's no stories, no historical events, just say yes and no to these. And then if you say yes, I will ask for an elaboration or maybe some more information, or not at all. I will literally just check yes and move on, because that's all we need to know depending on what it is. But no life stories. I'm sorry for your loss. I don't know what else to say after that. And I think this hazy thing is just my dirty camera lens. Watch, let's see how clean we can get it. Oh, yeah, see, less haze. I probably should have done that first. All right, well, I don't care. I'm not over it. I'm tired. I have a horrible headache that I woke up with, I think, as I grind my teeth. That's what happens when you get out of bed at 2:30 one day and 9 o'clock the next day. Messing with my circadian rhythm, and it gives me a headache. Okay, so face your fears, forget your failures, follow your faith, and I got a whole bunch more for next time. So I'll keep it coming.